Welcome to 340B Leaders Upfront, a new monthly podcast from 340B Report. I'm Anna Mangum, host of this new program, which showcases 340B Report's valued sponsors and the crucial role they play in the 340B ecosystem. If you're not already a subscriber, please consider subscribing to 340B Report by going to 340breport.com and using the coupon code PODCAST25 to receive a 25% discount. If you haven't heard prior episodes, here's a little bit about me. I've dedicated my career to promoting healthcare access, quality, and equity. I've been a senior leader with a variety of major national advocacy and trade organizations, including 340B Health, where I worked closely with 340B Report publisher and CEO Ted Slavsky for over a decade. In this exciting new episode of 340B Leaders Upfront, I chat with two leaders at PharmaForce, David Valentine, Chief Operating Officer of the PharmaForce PBM, and Anthony Velasquez, PharmaForce's Chief Product Officer. PharmaForce was founded in 2017 and has grown rapidly ever since. The Jupiter, Florida-based company serves as a pharmacy solutions provider, third-party administrator, and PBM, helping a growing number of 340B covered entities and self-insured employers with both 340B TPA services, such as inventory management, contract pharmacy, and split billing implementation, referral capture, and ESP reporting. In 2023, PharmaForce added a PBM offering optimized for 340B covered entities and provides a range of 340B pharmacy solutions for health systems and clinics. In 2023, PharmaForce added a PBM offering optimized for 340B covered entities and provides a range of 340B pharmacy solutions for health systems and clinics. We're very grateful to PharmaForce for being an Ultra Diamond sponsor of 340B Report, the highest level of sponsorship. We appreciate their investment in 340B Report, which helps us to educate our subscribers and listeners on 340B developments. Today, we'll catch up with David and Anthony and learn more about their careers, the solutions that PharmaForce provides, the current and emerging challenges and opportunities in the 340B space, and what they may mean for 340B stakeholders. Welcome, David and Anthony, and thank you for being with us today.
Thank you.
Hello. Thank you.
Could you share a little bit, each of you, about your life before 340B, including where you grew up, your educational path, and what you studied? Let's start with Anthony.
Sure. Let me first say it's an honor to be here. I'm excited to chat with you today. A little bit about me is I have been in 340B my whole life, actually right out of college. I went from being a clerical assistant at a health center that was 340B qualified to leading a 340B program. I grew up originally from the Dominican Republic, grew up in the North Philadelphia area in Pennsylvania, and went to a high school there, ended up going to Penn State University, and got a bachelor's in healthcare compliance and administration. That then led me to getting my first role as a 340B program manager at a health center that still serves that community there in North Philadelphia today. So I was given an opportunity to lead a 340B program there. Then I went on and got an MBA at Weiner University in healthcare administration. And from there, my opportunities open and doors open for me that I'm very grateful for. That led me to go and work for some of the largest health systems that have 340B programs in the area, and ultimately ended up in PharmaForce.
Thanks so much, Anthony. David, tell us a little bit about your background.
Thanks, Anna, for having us here today. Excited to share what we're doing here at PharmaForce, a little more about us. A little older than Anthony, so I got a little bit earlier start. So I grew up Detroit, Michigan. Recently this year just relocated to South Carolina to get out of those Midwestern winters. But I started, been in pharmacy my whole adult life. So kind of started right out of high school, started as a pharmacy technician. Academically, I started off this path. I was going to be a high school math and science teacher. But working in pharmacy, I'm like, wow, I can't exactly raise a family on those salaries. So I said, wow, I can do this. I actually almost finished my teaching program, and then I switched over my major to pharmacy school. It's 10 started pharmacy school. At that time, I started working in inpatient pharmacy, and was kind of torn. I didn't want to spend my rest of my life checking expiration dates and Pyxis machines and crash carts. So I was like, well, I got to get out of school sometime. So I ended up taking all my teaching and pharmacy stuff and cobbling together a business degree. So went to Wayne State University, later transferred to Central Michigan University, where I obtained my bachelor's in administration, and then later went on and got my master's in administration from Central Michigan University. It's hard to believe, but this coming year, I'll be in my 30th year in the pharmacy space and all different applications of it. So I got a pretty diverse background, including had the honor of being the 340B program manager at Michigan Medicine, which was University of Michigan's health system. And then before then, my 340B experience was in the early 2000s when I worked in retail administration. And we were trying to administer the 340B program back in the day when we didn't have third-party administrators like PharmaForce, and our pharmacies were having physical 340B inventories. And I was in the behind the scenes trying to figure out, how are we going to make this program happen with same NDCs and virtual inventory? So I've been kind of foot in, foot out of 340B throughout my career.
Terrific. Well, thanks for that, both of you, for that background. Before joining the team at PharmaForce, David, you mentioned you worked in pharmacy care management and 340B programs with chain pharmacies, health systems, and health plans in Michigan. And Anthony, you worked in the 340B space for several health systems in the Philadelphia area. What were some of the key areas of focus for each of you?
Yeah, I would say I started my first 340B role was at a grantee. So that was very different and a completely different world when I went to the hospital side. So I started at a grantee that had no contract pharmacies. And the sort of key area was to create a standard operating procedure for compliance and to have a compliant 340B program, because everyone that's in 340B cares about being compliant and making sure that you're ready for a HRSA audit. So that was sort of my first role, was to ensure that this grantee and this health center was ready for a HRSA audit and was managing the program in a compliant manner, a responsible manner, and then find ways to get more medications to uninsured patients. I had the honor of working, actually the most rewarding time, I would say, in my career in 340B was at a health center that we were able to use a 340B discount program to provide prescriptions to uninsured patients and underinsured patients, and provide 90-day supply of medications for like $8. And I've witnessed people cry because they were paying hundreds of dollars before at a pharmacy, a local retail pharmacy, and we were able to, because of 340B, provide 90-day supply of their medications for $8, $9, $10. So I still talk about that often because it really is some of the most rewarding time in my career. I'm much more behind the scenes now, and I'm not upfront dispensing medications, but that was something that was very rewarding for me. And then when I went to the hospital side, and that's a much bigger scope of managing mixed use and contract pharmacy, and implementing specialty pharmacies and home infusion pharmacies and all those things. So I really learned a ton of just project management, execution, operations, how to communicate on a project, how to plan a project, that have all been very, very valuable lessons for me. So yeah, that's a little bit about my specific, key areas of focus.
Thanks so much, Anthony. And how about you, David?
In all the different roles that I've had, my key area has been a balance of assisting patients obtaining the necessary prescriptions, drugs that they need to treat their health conditions, but also trying to manage that cost. And in the past 20 years, especially with specialty drugs, that's been a challenge to manage with the increasing costs that we have with the drug therapies. While the drug therapies are terrific, they come with high costs, a lot of them. So most of my career, no matter where it was in retail, I was in hospital health system, 340B, managed care at a health plan or at a PBM, it's all about that balancing act of managing cost and providing access to those drugs. A lot of my career in the health plan space was spent in government programs. So dealing with Medicaid beneficiaries and Medicare Part B beneficiaries. So assisting seniors, lower income, very, very much same the safety net type patients that the 340B program is trying to assist, trying to manage that. Once again, access versus cost. It was, my primary job function. A little bit 340B related was, when I was at University of Michigan, was using the 340B program to provide access through their charity care program, and using those dollars that we were saving in our 340B program to expand that access to care was probably some of the most rewarding things that I did when I was in my tenure there, especially where we expanded our cash discount card program from a couple hundred prescriptions a month to over 1,000 prescriptions a month through some of our indigent care. Well, not indigent, but even, people that have really lackluster insurance, maybe high deductible health plans and that stuff, who just simply couldn't afford their drugs. So it's always been the balance of cost and access. And even today at PharmaForce, that's kind of what I enjoy managing. And here at PharmaForce, trying to find new solutions to get better at providing access, but also trying to bend that drug spend curve line, try to flatten it out some.
So Anthony, 340B, as you've talked about, has been something very compelling to you. It's a unique specialty in healthcare and in pharmacy. So can you say more about what drew you to it? What keeps you passionate about it today?
Yeah, that's a great question, because the funny story is I started my degree was in IT. And after I took like 3 courses at Penn State in IT, I was like, I cannot do this. I don't see myself doing this for a long time. And then the campus that I went to offered a healthcare administration program with a compliance aspect. And I was drawn into the complexity of healthcare. I don't know why, but the complexity of insurance and payments and the entire healthcare system just kind of drew me in. And I was just in awe with how complex and all the different pieces it played, how expensive it was, and all of those things about healthcare. And that kind of was the step that put me in an opportunity to sort of land in 340B. I don't think I chose 340B. Like, I had no idea what 340B was. I more stumbled into 340B and was given an opportunity to lead a 340B program from being a clerical assistant at a health center that then got a degree. And I was just very fortunate to be given the opportunity to lead this program that no one had done before. And as I did the program, and it was as complex as I thought it was initially, but it was very rewarding because you were helping people and you were helping patients. I think that sucked me in, and it just felt like this was something with a lot of purpose, and also was something that required, thought and administration, and was important to the healthcare organization that I was working for. Right, 340B is always a very, very important part of every healthcare organization that I've worked in. It's 340B that have allowed it to, in some cases, even remain open. That developed, I think, the passion in me to really, want to dig deeper into 340B. And now I'm going on year 14 of all 340B roles since graduating college. For me, this is all I know, and I love it. I'm very passionate about it.
Well, that really comes across, like you say, people don't necessarily set out to work in 340B, but many people who end up there stay because of this mission that they have. So how did PharmaForce come about? What sets you apart in this increasingly competitive marketplace?
PharmaForce has a really interesting story. And really, back in that 2016, 2017 area, there was a love-hate relationship with the third-party administration offerings that were in the space. And entities' desire to be compliant, entities' desire to run a well-run 340B program, an optimized 340B program, but also do it at a fair pricing and fee structure. And what we saw as we were coming into the market is that the options that entities had were old technology with bad customer service, and the prices just kept going up every single year. And that was the sort of cornerstone behind starting PharmaForce. Was we just desired to offer entities the newest technology with the most flexibility, because if you see one 340B program, you've seen one 340B program. A grantee is different than a hospital. A hospital is different than a Ryan White. A Ryan White is different than a rural referral center, right? So because there's so much difference between covered entities, we knew we needed not only the technology, but the support. And that kind of started where we only hire account managers that have 340B experience, for example. And we needed to figure out how to do it at a fair price for entities. and do a cost-effective model. So that really is the story of what started. And we just started talking to folks in the space, and Dan, Dimitri, our CEO, and myself crossed paths. And that's sort of the story of how PharmaForce started and what we set out to do. And that's what we continue to do today.
That's a very interesting origin story for sure. You offer a full suite of 340B TPA solutions, with your initial focus being contract pharmacy and split billing, which you continue to offer. What products and services do you offer in this business line?
So we, again, going back to that initial reason why we started PharmaForce, is that the 340B market has continued to sort of expand in the way that it's operated. And it has created new challenges for covered entities that have not existed before, like the manufacturer restrictions, that started 4 years ago now, 5 years ago, and other reporting requirements and things like that entities are faced with, and executive orders that require you to provide cash card, pricing for insulins and things like that. So we really felt like we had an opportunity to offer a one-stop shop for all of your pharmacy solutions. Whether you need contract pharmacy, split billing, a PBM, a cash card program, help with ESP reporting, and all of those things, referral capture service, that we would become the technology leader in all of those areas, so that our covered entities will have to, work with one vendor, and so that's our vision is we want to be sort of the Apple ecosystem of the 340 space, right? We want to be the place where you get your iPhone and your Apple Watch and your iPad and your MacBook. And what else is you get contract pharmacy, split billing, referral capture service. You get our Claims Connect platform to submit to ESP and others, and our PBM platform. So you get everything in one place, all cohesive, all working together, all integrated.
Fantastic. Well, it's truly a robust portfolio. And you added a PBM portfolio in 2023 to that. Dave, can you tell us what inspired this? What's unique about the products and services that you offer in the PBM part of the portfolio? With PBM services so often operating in isolation from 340B, how does your solution bring these related but separate functions together? How does it benefit both the covered entity and their patients?
Yeah, when I was kind of hired in as employee number one here at PharmaForce, and when our CEO reached out to me, I'm like, wow, who wants to build a PBM at this day and age, right? I mean, PBMs are kind of a four-letter word in the pharmacy space, right? And that's kind of how we got our start, right? We have to have PBMs for our discount card programs to help our covered entities extend the 340B discount to the ambulatory patients, at retail. And what we found is PBMs stink all around, right? There's no perfect PBM, right? So a lot of the challenges we were having were with vendors. And those PBM vendors were causing our customers heartburn, which in turn was causing us heartburn. So our CEO, Dan Dimitri, said, well, we're a technology company. We'll just build our own PBM. And that's kind of what we set out to do. We built our own claims adjudication engine and all the things behind the scenes under the hood that make PBMs operate. We built those internally ourselves. So we didn't take any shortcuts with trying to go lease out other, vendor systems and white labeled relationships and that kind of stuff. We built it all ourselves. So it's all PharmaForce built, maintained, and owned. And that went really well. When we started transitioning our customers off the vendor solution for the discount cards, we had really positive feedback about a lot of the issues we were experiencing. Those issues were no longer an issue. And it was actually our customers that kind of advanced the next step, which was, what can you do for my employees? Because we hate our PBM, right? We hate for their employee health programs for our customers. And a lot of our hospitals are self-funded, from an insurance standpoint. They're not part of the insured market. They self-fund themselves. They're like, we don't like our PBM. We have no transparency. We don't know what we're paying for. We don't know what we're getting. So they said, what can you do for us? And that's kind of what we did. We went to the next level and we built a full service PBM option for not only just hospitals, health systems, and other covered, 340B covered entities, but for any employer that's self-funded. What really makes us different is our PBM philosophy to start with, right? So most PBMs are always thinking about what is their revenue opportunities. And we don't have that philosophy here, right? Our philosophy is how do we get our customer to the lowest net cost for a prescription drug? And it goes back to my access versus cost that I mentioned earlier, right? That's what PBMs should be challenged with managing for employers. It's how do I get my employees access to drugs, but also manage the dollars that the employer has to pay for those drugs. So with our lowest net cost philosophy, that kind of really separates us from the pack. I mean, there's this quote transparency that every PBM says they are today. It's kind of this, I hate even saying the word, but but we are truly transparent with how we operate. And our revenue, the revenue on the PBM side is such a way that we give tools to our customers that other PBMs utilize to drive their revenue. We put those tools in the hands of our customers, and that allows them to not generate revenue, but generate savings to their employee health program. So now you layer on 340B. If we have a customer that's a covered entity, well, patient definition, your employees can be patients there, and those prescriptions can become 340B qualified. The real beauty of PharmaForce as a PBM is if our customer has us as a 340B TPA and we're managing the employee pharmacy benefits here at PharmaForce, our systems are integrated. Our PBM speaks to our 340B. Our 340B division speaks to our PBM. And anybody that's worked in pharmacy, either one of those spaces, know that it's hours and hours and hours of VLOOKUPs and spreadsheets trying to match output from a TPA from output from the PBM. We do that in real time. So we have that real-time reporting. And I think if you're a self-funded employer and you have to be a covered entity, I think our solution, both our TPA and PBM combined, really gives you advantages to, one, optimize your 340B program. Because when you start having your employees in the mix, you start getting insights that you didn't have before because you didn't have that visibility. A lot of it strategically by the PBM. A lot of covered entities we talk to can't even get their employee pharmacy claims to even do any analysis on. So you have that advantage to maximizing your 340B programs, such as identifying leakage opportunities, maybe finding contract pharmacies to add into your contract pharmacy network. But you go on the other side of the house, on the human resource side of the house, and now you have an opportunity to leverage 340B to help offset some of the expense that the employee health plan is picking up. And what we found is you start having pharmacy directors talking to HR directors and VPs that usually would never talk with each other, even knew they existed. Now they have this partnership where the pharmacy area takes an active role in managing the employee benefits. And it's a win-win opportunity for the pharmacy department, for the HR in terms of their total employee health spend, and then the organization wins overall. So having that integration is so important for us to get the data insights. And in addition to the tools that, once again, those other PBMs that keep to themselves, we take that consultant approach saying, hey, these are your options. These are things that you could do to help your employee health plan that also helps your 340B program. So it really is a everybody wins solution, including the employees.
To that point, can you share a client success story that really demonstrates the value of everything you've just described and of combining 340B and PBM solutions?
Yeah, absolutely. We have a small rural access hospital that where they're 340B TPA, and we're also the PBM that manages their employee benefits. In the PBM space, a lot of times we measure, there's lots of statistics to identify how well your employee health pharmacy benefits doing. One of the ones we use is PMPM, which is per member per month. How much money does it cost per month for your pharmacy spend for your employees? Well, this critical access hospital was in over a term of a year with all the cost saving things that we have as a PBM that we're able to provide them, with them layering on the 340B program. they were able to drastically reduce their costs for their overall employee health program. On the pharmacy benefit side, they literally cut their PMPM in half in the first year. So they cut their drug spend in half. And that had implications to the next benefit year, because the next benefit year, they had these savings that they weren't projecting because of all the changes we partnered with them on and achieving those. It came to the point that they were able to keep premiums the same. So there was no increase in the employee premiums come the next open enrollment period. But they also were able to use those savings on the drug side to lower things such as their office visit copays, their specialist copays. So they were able to spread those dollars that they were saving through our PBM solution. And it's a partnership. It's a partnership between the covered entity and PharmaForce that's achieving the savings. They were able to pass that down through the medical benefits that also beneficiated the employees through reduced costs on the medical side of things. So to tell anybody in today's space that when drug trend line is almost vertical and you're saying, well, they not only did they bend it flattened out, but then they cut it in half. It's just amazing the results that we've been able to produce with that particular client. And we continue to try to find saving strategies to help them save more dollars to their employee health program.
Well, that is a great success story. Congratulations. Let's shift for a moment. We're going to talk about contract pharmacy. As you both know, they remain under pressure with almost 40 drug manufacturers imposing restrictions. Some states are passing legislation to undo that, but easing some of those restrictions. Others are adding new reporting restrictions. How are you staying ahead of the changes and helping your covered entities in navigating this complexity?
We kind of approach this in a couple of different ways. And I first want to say 340B report does an amazing job at reporting on this. And that is, I would say, our main source of real-time information for what's going on in different state policies. So we're really grateful for all the work that you do. The interactive map is awesome. And we use that. But we kind of see it as like, we do three different things. Number one is education. We do a monthly webinar where often I will lead it. We brought on, I remember doing one in the summer with a representative from Mississippi that helped actually draft the legislation for their state contract pharmacy access bill, and often encouraging covered entities to participate in their state efforts to do a contract pharmacy access bill. So we educate, we provide the technology solution to self-service, and then we also provide, the account management and thought partnership and support on how to set it up and how to optimize your program when you're dealing with a contract pharmacy restriction. So those sort of like the three buckets of things where we use education, technology, and support for our entities to help deal with the complexity, because it surely is complex. Every entity, is different. The grantees, again, are different than hospitals. So they might require a different type of setup. But that's where we're positioned by the fact that we hire account managers that have 340B experience, that came from a 340B covered entity. We're really able to be a thought partner with covered entities to work with someone that understands their pain points, understands what they're dealing with, and can help them customize a solution that will help ease their burden on submitting claims and tracking and designated pharmacy and things like that.
Great. Well, thanks for that. In addition to contract pharmacy being something that providers are concerned about, there's the possibility too of shifting 340B from an upfront discount program to a rebate model. What's your perspective on this potential shift and what it could mean for providers and for patients?
I guess my short answer is we don't believe that this is the right way for the program to go. I think the 340B has operated compliantly for decades, and we don't believe that this is the right solution. We believe that this is going to create a lot of chaos for covered entities. We believe that this is going to be very complicated for covered entities to even access those savings, and ultimately will leave some covered entities that don't have the resources unable to access those savings without having the ability to have staff that now need to, take on this entire task of submitting claims, reconciling a rebate, and all these other things that are now coming down the line. However, we also see this as yet another opportunity for us to provide technology solutions to help covered entities in the midst of reality. In other words, we don't agree with it as a company, but this is the reality that covered entities are facing. And this is yet another barrier in the way. And we are committed and have already begun thinking through how we can use technology and how we can do that quickly because we're nimble and we can adapt quickly as changes come, because of sort of, as I mentioned before, using the newest technology as a core principle of our founding. We believe that we'll be able to help our entities as best as we can to support this new world when it comes in January of 2026. So that's our thought, but this is unfortunately the reality, and we're ready to provide solutions to the market to help entities navigate this.
Well, 340B is definitely and has always been a dynamic space. That's true of healthcare in general, no less true here. So thank you for those thoughts. Do you have any final words of advice or thoughts for the 340B community?
Yeah, I would just say one thing to the 340B professionals. I'm a big advocate of just the 340B managers, analysts, compliance team members that are out there on the field dealing with managing a 340B program. And my encouragement to you is just to, keep working on your skills, keep learning about artificial intelligence and, how to become better with Excel and presentation skills. Keep investing in yourself as a professional, because I truly believe the 340B space is a wonderful space for anyone that is wanting to sort of grow in that career, and that those opportunities to either work at a hospital or work at a third-party administrator or work at a wholesaler distributor or work as a consultant. There's just so many different things where you can use your gifts and your skills in the 340B space that I just think will become more and more valuable as the market becomes more complex. So if you're a 340B professional out there, work on yourself, continue to educate yourself, learn about new things, new technology, gain new skills, because that will make you more valuable to your company and in the marketplace.
Well, that's so well said. Your passion, both of you, for 340B comes through today, and we really appreciate your time and for sharing so much about your backgrounds and about the unique value proposition of PharmaForce. We want to just thank you again for joining us, and stay tuned, folks, for our next podcast, which will drop next month.
Thank you.
Thank you so much.
Thank you for joining us today. We look forward to having you join us for our next podcast. If you're not already a subscriber, please consider subscribing to 340B Report by going to 340breport.com and using the coupon code podcast25 to receive a 25% discount. It's the best way to stay on top of the latest developments in the ever-changing 340B program. Also, check out our other podcast, Inside 340B Report, to hear our journalists discuss the latest 340B developments.